So today we'll talk about psoriasis and its homeopathic treatment. I'm sure you must have seen hundreds of videos on YouTube and on Google about psoriasis and about its homeopathic treatment, and you might have also seen some people claiming that homeopathy can cure psoriasis and so on and so forth. I would like to share with you some genuine information based on significant number of cases of psoriasis that we have treated in last around 40 years time. Let us understand what is psoriasis. Psoriasis is a skin disease, but actually it is not a skin disease in the sense that disease on the skin, but it is caused by various internal factors such as genetic factors, immunological factors. These are the two major causes whereby one develops psoriasis. So because of certain genetic tendency to develop an autoimmune disease, sometimes a patient may have a family history of other autoimmune diseases such as lichen planus, vitiligo, underactive thyroid, cancer, rheumatoid arthritis, and may develop psoriasis. Patient might feel that, oh, but nobody in my family had psoriasis. But when you trace it out, we find that nobody had psoriasis, but somebody had another form of autoimmune disease in your family. That's how you develop this genetic tendency. And this genetic tendencies, which is kind of hidden, which could get triggered by various other factors such as stress factors, environmental factors, food factors, chemicals exposure, etc. And that's how one ends up having psoriasis, which appears in the form of scaly eruptions on the skin, in which you find irritation, inflammation, swelling, itching, and scaling of the body. So scaling is the characteristic of psoriasis, and this exfoliation or scaling which is on many parts of the body, and that's how psoriasis appears. So when you decide to treat psoriasis, it is very clear and logical that since psoriasis is a disease on the skin, but it is not a disease essentially only of the skin. It means the roots are much deeper, and when you treat psoriasis, you have to see that the treatment which is being used is not just to clear the skin superficially. The treatment has to be much deeper. So conventionally, psoriasis is treated by using certain form of anti-inflammatory immunosuppressant medicines such as corticosteroids, which may help to treat psoriasis, but for a short time. One spot of psoriasis may go and another spot may come. It is often seen that you may treat 5 patches of psoriasis with the use of corticosteroids and then disappear, but very soon maybe 7 or 8 will appear because the disease is not getting treated internally, it is just getting treated superficially. So this is how, as a patient of psoriasis, you may have already observed that when you use such steroidal creams or any other immunosuppressants, you are actually not benefited long term. You might get initial benefit and initial happiness, but eventually your problem increases. When the disease of psoriasis comes back after using such immunosuppressant medicines, either in the form of ointment or cream or even taken orally, when it reappears after some time, the problem is that it reappears more than before. That is what is commonly observed. Not only that, it reappears more than before, and it is also more difficult to treat than before because your body gets used to the use of immunosuppressant chemical-based medicine and it comes out stronger than before. That is how we observe this kind of phenomenon in nature. So when it appears and reappears and reappears, it becomes stronger and deeper rooted and it becomes more difficult to treat. What does homeopathy have to offer for psoriasis? So let us talk about that. Homeopathy has, I would say, reasonably good treatment for most cases of psoriasis. Psoriasis responds to homeopathic treatment more, especially in the recently developed patches of psoriasis. If you are having psoriasis for 6 months to 1 year or maybe 2 years, and if you start with homeopathy, the chances of results are much better. If you start homeopathy after 5 or 10 years of having psoriasis, it is relatively more difficult to treat. If you have not used any other form of immunosuppressant medicines like corticosteroids or methotrexate, then the chances of recovery using homeopathy are much bigger. In our experience, we have seen that the patients who have very extensive, long-standing psoriasis for many years with the affections of nails and joints, they become more difficult to treat. Psoriasis on the scalp is more difficult to treat than psoriasis on the rest of the body. If you have used certain stronger immunosuppressant medicines like corticosteroids and methotrexate in particular, then it becomes extremely difficult for homeopathy to bring recovery. That is a common observation we have. Sometimes to an extent that we refuse the cases of patients who may have taken methotrexate for more than 6 months, 1 year, 2 years, 3 years. And then because in such cases, It is difficult to stop methotrexate, and if you stop methotrexate or even reduce it, the relapse is so severe and it is so obstinate that homeopathy medicines have great difficulty alleviating the symptoms and the relapse. So all in all, homeopathy is extremely useful in the cases of psoriasis, as I said, early cases and mild to moderate cases, and less treated with immunosuppressant medicines. That forms a good case for homeopathic treatment, and otherwise it becomes more difficult. Of course, when you are getting treated for psoriasis, only homeopathic medicines or any other medicine for that matter is not adequate. You need to bring certain lifestyle changes such as good diet, good exercise, less stress, enough sleep. All this put together will help you get relief from psoriasis. One has to accept that psoriasis is a chronic, long-standing disease. Many patients may have psoriasis which may go away and go into remission, whereby the patient may be free from the disease for 1 year to 3 to 5 years. The job of homeopathic medicine is to take psoriasis into a remission as much as possible. However, we may not succeed in every case to lead it to remission, but many cases they are known to go into remission after using homeopathic medicines. Some cases of psoriasis may not go into remission at all, and they may have a tendency to remain for life or for many years or decades. And we cannot really determine which cases will remain for longer and which cases may go into remission. We still do not understand this disease. And you must also know that psoriasis is still not a fully understood medical disease. There's a lot of research going on, and it's a very complex disease. Immunologically, we have little understanding about psoriasis as of today. So all in all, I'm trying to give you a balanced view on the treatment of psoriasis using homeopathy, and I believe this will help patients who are seeking help using homeopathy for psoriasis. Thank you very much.